An important health story for you now. Future deaths could occur if action isn't taken to address the treatment of those living with ME. Those are the stark warning words of a coroner following an inquest into the death of this young woman from the disease.
27-year-old Maeve Boothby O'Neill had been living with a debilitating condition for more than a decade before she died from malnutrition 3 years ago. Our reporter Steve Nibbs has more.
Since she was 13, Maeve Boothby O'Neill suffered from fatigue, but after finishing her A-levels, her condition got worse and she was diagnosed with severe ME. In 2021, she was admitted to hospital 3 times and in the last few months of her life was confined to bed, unable to chew food or drink properly as she couldn't sit up. Maeve died at home in the October. The coroner, Coroner Archer, concluding her death was from natural causes due to her ME. Now, the coroner has sent a Prevention of Future Deaths report to the Secretary of State Wes Streeting, as well as a number of health organisations. In it, she said that following the inquest, it was clear that there were no specialist hospitals, hospices, beds, wards or other healthcare provision for patients with severe ME in England. This meant that Maeve's hospital, the Royal Devon in Exeter, had no commissioned service to treat her. There was, the coroner said, no current funding available for research into the treatment and causes of ME, with limited training for doctors. The Department of Health said that its deepest sympathies were with Maeve's family and friends, and that this is a heart-wrenching example of a patient falling through the cracks. The department acknowledged the NHS had repeatedly misunderstood and dismissed Maeve. It said it was now committed to improving the care and support of all those affected and will publish a plan in the winter to boost research, improve attitudes and education and better the lives of people with this debilitating disease. Maeve's family are angry that it's taken her death to highlight these issues that she knew herself and that were no surprise to anyone affected. Maeve desperately wanted to change things to save her life and countless others. Before she died, she told her mum, "At least we know we tried." Steve Nibbs, BBC News.
We're joined now here on the programme by Maeve's mum, Sarah Boothby. Morning, Sarah. Thank you so much for talking to us about this. There is a phrase that strikes me from the coroner's words, and it is that the phrase is misunderstood and dismissed, that's what happened to Maeve. Just explain to us how those words have settled with you.
Well, thank you so much for having me on again. I think the thing that I'm feeling most is really frustrated, as are all of the other people who've been diagnosed with ME for a long time. We all know that Maeve was not the first person to die. There are more people now who are dying, I can promise you that, because of the numbers. And since COVID, the numbers of people with ME have increased to 700,000. But along with that increase has come a whole load of knowledge from very, very experienced doctors who now have ME themselves or who have family members with ME because of the long COVID that is ME, which is around half of it. And I think my frustration really stems from the inquest not being any further on than we were 3 years ago. Maeve knew, I knew, all of the people who are listening to this, watching this now, they know, and they are being prevented, as is Professor Hemsley from the Royal Devon Hospital, from bringing about the changes that will prevent deaths. And I find that more shocking than anything else that I can say. You know, I'm almost speechless about that. Why would the NHS prevent more deaths? They've had every opportunity ever since the inquest opened to learn what Professor Hemsley has learnt, what Maeve already knew, what I already know, and all of the other people with ME also know.
Sarah, I remember, was it back in the 1980s maybe when we started talking about ME, and there were some doctors who sort of questioned whether it really existed, and some people who were suffering really struggled to be heard and to be taken seriously. Do you think we're still living with that legacy now in 2024?
I don't think we are in the new generation of doctors. So the people that I've just mentioned, for example, they know what ME is and they know how to treat it. What they can't do is treat it within the NHS. So there's a layer of management within the NHS that may be stuck in those old ideas. Quite possibly they are, because that's the only explanation I can come up with that explains why they don't want to change. You know, as we all get older, we become more and more resistant to change. I know there's a whole generation, so Professor Hemsley is one, Dr. Benita Kane is another, Dr. Claire Taylor is another, but they cannot, none of them can get this through in the NHS. And yet the numbers of people with ME are rising because it's a post-infection disease. And the earlier you treat it, they all know this, the earlier you treat it, the sooner you stop its progression. Maeve knew that, and I knew that when we were going into hospital time after time. What we couldn't understand is why the hospital didn't know it. And Professor Hemsley has shown everybody the reason the hospital doesn't know it is because the NHS executive doesn't know it. Why they don't know it, they need to explain. I can't do that for them.
So, Sarah, you say that action could be taken to save lives now. What would that be? What is that action?
Well, I think the problem for the new government is really profound. So I appreciate that the coroner has written to Wes Streeting, but what they have inherited, this new government, is the most horrendous mess. And ME and the plan for ME is no different from the rest of it. My suggestion to them is that they talk to the people that know, and there are tens of thousands of people that know, but the people who are advising them at the moment really genuinely don't know, and that the educational package that is coming out is absolutely pointless. It's not going to help anybody. Professor Hemsley could help them, Dr. Kane could help them, Dr. Taylor could help them, I could help them. All of the families that I know, and there are a lot of them, could also help them. We're all really ready and willing to help. The earlier you stop it and start managing the symptom, the main symptom, which is manageable, and if Maeve had been treated for that symptom from the very beginning, she would not have needed the round-the-clock care that she ended up needing and didn't get, except from me. And that's the same for every other person with ME or long COVID ME, as we're now starting to discover.
Just saw some lovely pictures of Maeve when she was young. I mean, the irony here is that she was so knowledgeable about the condition, wasn't she? She understood it. What do you think she would have made of this coroner's report, those words?
Well, she was very witty, and she'd have had a very funny one-liner that I'm afraid I don't have that skill. But she was very, very witty and very knowledgeable. And that's the biggest frustration for all of us, really, that there are so many very, very knowledgeable people who understand what ME is. They know how to manage it. They know how to stop it from getting worse. And that knowledge sits with us, and nobody seems to be able to take it. I don't know what she'd say, to be honest. I couldn't. If I had her, I don't know. She was just a gifted person with words. If I had that gift, I wouldn't need half as many words as I use now.
Sarah Boothby, you've explained very clearly and very. Strikingly, what you and other families have been going through. Thank you so much for coming and talking to us and explaining that. And we'll speak again, I'm sure. Sarah Boothby there, joining us from Exeter.
Thanks very much.
It is exactly